The next speaker is BURA, Orbital Exenteration in
Bindu,
post-COVID.
postgraduate from RMC, going to present a paper on our experience in orbital exenteration in the postcode ROCM management. ROCM is a lethal angio-invasive fungal infection and its incidence has greatly risen during the India second wave of COVID-19 pandemic in patients who have tested positive for SARS-CoV recently or in the past, with the major risk factors immunosuppressive conditions, uncontrolled DKA, renal failure, and corticosteroid therapy. To 90% mortality rate is seen in ROCM cases with cerebral involvement, and for cases of ROCM with COVID-19, the overall estimated mortality rate is 31%. Hence, early and aggressive surgical debridement of the infected necrotic paranasal sinuses and orbit, and sometimes more aggressive orbital exenteration may be required to decrease the fungal load and to prevent the intracranial extension. The study was a prospective interventional study done in the setting of Department of Ophthalmology, Rangaraya. A total of 10 patients who were all clinically diagnosed cases of ROCM were selected, and the study was carried out for a period of 3 months by using the study tools like Snellen's visual acuity chart, slit lamp biomicroscope, appellation tonometry, and the fundus examination. Patients who were on treatment for stage 3C to 4D requiring exenteration as per guidelines, and those who gave consent for exenteration were included. Patients who have not given written consent for exenteration were excluded. Detailed history taking, thorough clinical examination, and DNE were performed in all patients, followed by the radiological investigations, and the medical treatment with systemic antifungals were given to all patients according to the patient's stage of disease, followed by the surgical debridement. In cases with extensive orbital and CNS involvement, based on the guidelines given out by Sir Hanover et al. And AP government, and upon advice from the neurology and neurosurgery departments, in order to curtail mortality, orbital exenteration was done along with the FES. All renal parameters, blood sugar levels, serum electrolytes, complete blood count were regularly monitored, after which patients were safely discharged and followed up on OPD basis. In results, incidence of ROCM was found to be more in males when compared to that of the females, with the mean age of presentation being 51 years. Diabetes mellitus and impaired glycemic state at presentation were found to be the major risk factors, and the left eye involvement was more when compared to the right eye, with an average visual acuity of no PR. Bilateral pansinusitis with orbital extension by erosion of medial and inferior walls were found in majority of the cases in CT, and the MRI findings include thickening and enhancement of the optic nerve with mass effect, globe deformity and the collapse, and the intracranial involvement in the form of cavernous sinus thrombosis, multifocal meningovasculitis were found in 6 patients. Study the patients were staged and treated as per the guidelines given by the Hanover and the AP government, and the type of surgical intervention carried out was orbital exenteration along with the FES, and the surgical outcome was very good, with 9 patients recovered and stable on systemic antifungals. 1 patient expired due to anesthesia complications. Wound caving noted in 1 patient with subtotal type. These are the clinical pictures of the patients. Diabetic mellitus and the corticosteroids are the important risk factors. Glycemic control is given the first priority. Owing to the rapidly progressive nature of the disease, ROCM can rapidly involve the brain in a sequential form within no time, leading to fatality. Management with the strict control of hyperglycemia and antifungal agents and optimal surgical debridement, and in severe cases, FES along with orbital exenteration is indicated in these patients. Exenteration can be carried out as per the guidelines in patients with even visual study, exenteration was done only in cases with no visual potential due to consent issues from the patients. All patients in our study were proven ROCM cases. Earlier disease progression was less in patients worse than stages 3C, those who are treated with exenteration than those without. In our study, 8 patients were managed with FES and subtotal, and 2 with FES and total exenteration. 9 patients were stable on systemic antifungals, and only 1 patient wound care was given with daily saline dressings. In our study, the recovered stage 4 patients include those with cavernous sinus involvement, frontal and temporal lobe abscess, and multifocal meningovasculitis. As per the OPI IGO study, mortality and disease progression was seen in 39% of the patients treated with exenteration as compared to 52% in patients without exenteration. In the study, the mortality rate was greatly reduced and the survival rate was found to be 90% of 4 months. Thus, in patients with involvement of the CNS, contrary to the understanding, our study found that exenteration is beneficial. I conclude my study saying that COVID-19 associated ROCM needs to be tackled as aggressively as the disease itself. So, a good counseling about the necessity and availability of the cosmetically sound rehabilitation may help patients in accepting this radical but potentially life-saving procedure.
Yeah. So all patients who underwent orbital exenteration, they have much higher chance of survival. What about the morbidity? In the sense that any neurological loss was there in those patients who underwent orbital exenteration, who survived. What was the morbidity? Other neurological features they developed. Survival is not the only thing. So either they survived with lot of neurological defects, or what was the scenario there?
According to all the dignitaries from parents, come to the question, the patients who underwent orbital exenteration, I agree that the survival rate is very good, sir. But coming to the morbidity, I agree with you, sir, because most of the patients have some of the CNS problems like their slow recognition of the patient faces, and that too mostly the immediate post of AIDS. But with the follow-up systemic antifungal therapy, liposomal amplification for 4 weeks, and then they have even intervened the cerebral abscesses which were found in my cases and meningovasculitis here. So the recovery was good and the morbidity was also reduced. So these patients they have gradually recovered at the time of discharge, and all the 9 patients in our study, they were able to walk by themselves, and they were able to speak and speak up their own problems also, sir. They are being followed till date also.
Thank you.